mock drills of various, maybe BLS mock drills in NIBH hospital or JC accredited hospital. Once in a month, they will conduct mock drills for BLS, ACLS, depend upon the area. And even in the colleges or in the hospital, in the other institution, they also maybe cold blow drills or maybe fire drills. So many drills. They all are based on traditional one. You follow this. But in relationship-based education, it is role play. Role play means people are acting it out. People are taking the particular role. So here we can connect. I become a patient and I am acting like a patient. Then I know how a patient is going, what are the stages the patients are going through. So this has to be understood. That's how the role play or simulation is replaced with the mock drills. And then, you all are familiar about the checklist. You know, every procedures have been demonstrated with checklist. That is traditional way of learning. But in a relationship-based education, it is reflective practices. That means we are analyzing your experience, your emotions, your emotional challenges. How do you feel to care for a patient in that particular day? Madam was discussing, Elizabeth Madam was discussing about the reflective journal. Instead of writing the, morning 9 a.m. to 2 o'clock, you might be then list certain, and every day throughout the clinical posting, you look at the student's diary, you will see that every day morning they do bed making, they reach there, they have done something, story writing. So instead of that, we can go for reflective journaling. So that is experiencing, how the experiences can be analyzed. And then with that, you are going to learn a lot. You will go far than the place where you are standing now. And then finally, the other difference is in the traditional way of teaching, it is standardized exam. After completing the 6th sum or 7th sum, you are going to have a university exam. So your aim is what? To qualify that particular exam. That is standardized way of teaching. But in relationship-based education, they are not looking into the standardized exam. They are looking into the mentorship. How a mentor can train a mentee. Clear? So if the skill of a mentor, the qualities of a mentor is being transferred to the mentee, so they are being well trained with the emotional or with the holistic approach. Clear? So this is the, which one is better, relationship-based education or traditional education? Relationship-based education. Very good. So we will adopt that. You agree for it? Okay. Let's see. Now here I have already explained this, how we can view a student as a holistic way or as a whole. Like I said, you already intellectual being, emotional being, physical being, social being, spiritual being. This all I have been explained. So I think you people have further explanation required. Next is, what are the principles of relationship-based education? First one is mutual respect and trust. Mutual respect means every student or every learner, even here not only student we are discussing, your learner is patient is also a learner. Family member is also a learner. So every learner is valuable and they all have uniqueness. Everyone's ability is not the similar. It's all differ from person to person or individual to individual. So we need to teach them with dignity, empathy and trust. Development of trust, it's very important. You heard about, did you see how puppies are being trained? Puppies, you know, na? Doggy ka small bell babies. How they are being trained? How they are trained? In a day, is it possible? I heard some of the jail, the prisoners, criminals, they have been given puppies to train. It's a reverse reflective learning. Okay? So, how if you need to learn or you need to teach something to the puppy, first thing, the puppy has to develop a trust with the owner or the trainer. Otherwise, puppy will not accept any gift which is given us in the form of treat, because it's a trial and error method how to train them, or it's a classical conditioning. We are trying to train them. Same way, the teacher or the instructor has to develop trust. Kiske saath? The learner, with the learner. So you need to, that is the first thing, mutual respect, both give and take away policy. You respect the student, students will reflect it back to you, and then you develop trust with the students or the trust with the teacher and with the student. So the learning will be more effective. Okay. Second one is authentic connection. A connection, genuine relationship with the students. It's for the purpose of good relationship. Okay, so you should have you should be the very active listener. You listen to the student also should listen to the teacher. Should be a one-to-one active listening skill. Eye contact. There are eye contact. There are certain cultures that don't look at the eye. That is arrogant scene. But in our India, it's a respect. So we are not looking into the transcultural right now. We are looking into the Indian culture. Looking at the eye or eye-to-eye contact is a respect. While somebody is talking to me, I will look at this way. Will you like it? No, because it's a disrespect to you. So you should maintain that. Then emotionally engaged. Should show the empathy. And your presence should be there. Or kuch karte, you are listening to the student, you tell me. So that means what? You are physically not present with the student. Clear? So you have to be physically present. So next one is mutual learning and growth. Both has to grow. Kaun kare idhar both? Teacher and the student, or the learner and the instructor. Both are going to learn and grow. If you are a good teacher, along with the student, you are also going to learn. You are also going to be growing in knowledge, growing in skill. Emotionally, you become intelligent, and you have for that you need to have self-awareness. You should know what are my strengths and what are my weakness. If a teacher is well aware about their own self-awareness, or they are well aware about their self strength and weakness, then they can practice this relationship-based education. Next is holistic approach to learning. This I have already explained to you. So it's you are not only educating, you are not only looking into the syllabus. Syllabus is not only your content. What is your content? Human is your content, because students are not, their brains are not to fill and hands are not to train. It should be both. Okay, whatever you are going to fill in their brain and to train in their hands, both should be having human connection. Next is reflective practice. Reflective practice is encouraging students to analyze the experience, that not just to complete the task, just completing the task. History collection is one of the tasks for you all. So what you do, I need to take a history of a patient. I just go and take how are you, what's your name, once superficially information, come back, go to the doctor's file, and what doctor might be written something there, copy that. Multidisciplinary, maybe physiotherapist written something, or lab technician written something, collect all those things, come and present. No, that's not. What you need to do, first, or with the person. So what is that? It's not just completing the task. I'm not just taking the information from the patient. Why I'm taking this information? Because while talking to you, patient will experience stress release. Patient might be waiting for somebody to talk to, and then just give away whatever the information. Something was burning in their mind. They just want to give it. They want to talk because there might, especially geriatric people, there is no young generation have no time to talk to them, so they will not be talking to the patients or to the geriatric population. So talking to the person, so that old man or woman, whoever, this he will be or she will be expressing his all feeling. With that, you are getting information. Moreover, patient is getting a stress release. So it's very important. So that is reflect. Then once you come back from your clinical area, you discuss it with the CI or your teacher. So that is reflective practice. You are reflecting it on your experiences, or you discuss with your peer group. Today I met a patient, and that this is what's the condition. Patient also happy, you are also happy. So you are learning by discussing it. You are analyzing the experiences. That is reflective practice. Cultural sensitivity and inclusion. We are diversity, cultural diversity we have in India. So I don't think in my college we don't have a different culture students. But if you get into the hospital, you get a various cultural people there. So you go and learn from various culture, and then you introduce that culture to your peer group, so that different culture you are experiencing or you are discussing. So that is cultural sensitivity. Then you know what are the things sensitive in that culture, and what are things you should discuss, and what things you are not supposed to discuss. So that is cultural sensitivity and inclusion. You need to understand that there is diverse culture, and then we need to respect each cultural values. Contextual learning. Contextual learning is you are learning a lot of things in the theory classes. You are sitting and talking about various things in the whatever you learn in your theoretical classes. You need to link it with the real situation. If you don't link it with the real situation, then there is no value of your learning. So here, for that, simulation classes, standardized patients, or high fidelity mannequins, they can talk to you. You talk to them, they will give you answer. Same way, there are standardized patients. They will be acting like you know the movies, all the actors or heroines, they are standardized patients. They are discussing about various situations, how they are going to react. Same way, we can utilize people. So standardized patient, they will be acting it out, and then you will be talking to them, or you will be caring for them. So that is contextual learning. Emotional safety. You all know mistakes. We all create mistake. We all students, we are human, so we do mistake. But each mistakes are growth opportunities. Each mistake से आप क्या learn? आपको what you need to do? You need to learn. So today I have done mistake. I said sorry. Tomorrow I will repeat the same mistake. I will again say sorry. So I go on do that, and I go on say sorry. Is there any growth? No. So what you need to do, each mistake you need to take it as a growth opportunity. You are learning from mistake, because you see, when a child will start to walk, how many times child walk or stand? Once the child stood, fell down, next time the child to, oh, मैं गिर जाऊंगी, I cannot, I'm not going to do, it's over, my opportunity, to consider it in that way. Then collaborative centeredness. It means yourself Your interdisciplinary team like doctors, lab technician, pharmacist, many other healthcare team members, even family. Informal education you heard about. So informal education is from the parents, relatives, from the people around you, even collaborative centeredness. Okay. So these are all the, there are many benefits if you go for relationship based education, because I have discussed in the impact of relationship based nursing based education in nursing. In there I have said many points. So first, for the students will be very happy. You go for relationship based. First one is personalized support and engagement. Here we are giving more importance to the students. Their confidence level will increase. Confidence increases, it is a form of motivation. Then second one is they are more likely to take initiativeness. Listen to her. Is it? Or this teacher I don't like. Attitudes. So here, if you make such stronger clinical preparedness. I said you that human, we are nurses, we are not programmed Alexa, because we are caring for human. We are being trained to care for human. Okay. So first thing you should imagine, you are a human and I'm caring for a human. So who patients are all humans, whatever the situation they are going through, whatever the the disease condition or which stage they are, maybe even then they are in the terminal stage of illness, still you have to consider them, and you try to make a patient centered. You imagine your parents, your family members, your dear and near ones in that situation. Then you will have a empathy, you will have a compassion, it will be built within yourself. So same way, the students, when they are in the clinical area, future better nurses. Then for the educator, it's a more meaningful teaching experience. It foster relationship based education is going to foster deep respectful connection with the students. So you will feel I like many of the classes, if I go, I say I like to go to that class because they are very responsive. But some classes the teacher himself or herself say no, I don't feel like to. Why? It's because teaching experiences is not much meaningful. So make sure each instructor should make sure that the students are tomorrow's nurses, tomorrow's teacher. So make sure that your connection with the students are more effective. So you need to make deep, trustful, respected relationship with the students so that teaching become more effective and it more experience. It's become an experience. Experience, you all know what you go through. Okay. Then better classroom dynamics. Positive classroom dynamics and negative classroom dynamics. Positive classroom dynamic is that when students are having more output, that when output increases, when they are learning more better way. So that happens only in a positive dynamics. They are listening to you, they are active listeners, you are showing empathy, you are showing a lot of respect. Mutually, it's mutual respect, so that the trust develops, and both collaboration. Sometimes teachers will give assignments to the student, as I teach students, they will just ignore it because there is no collaboration. So collaboration, it's important. If there is collaboration with the student and teacher, then both will be in a more important way. It will be more advantageous for both teachers and for the students. Then impact, greater impact and legacy. That means teacher become role model. You know the role models? Yes, many of the film actors are your role models. Film heroines are your role models. Some people, political leaders are role models. Same way, some students, teachers are role models. So, role model means that the teacher is trying to shape the students according to the way they need, according to the way the universe required, or the global requirement in their knowledge, in their skill, behavior, so that there will be a professional identity. So that is what the impact that you will get it. And for the healthcare system, more production of compassionate nurses. This is go do their work and come back. Even teacher in between, they don't want to take care of anything. Struggling with things others also talking about. I'm talking about a relationship based. So here, the relation between teachers, between students, and between student and teacher, the nurses, the future nurses will be compassionate nurse, and they are communicative. They need to develop these qualities within themselves, so that the quality of care can be enhanced. And when quality of care enhances, patient satisfaction will be more. Okay. Second one is improved teamwork and communication. Here, teamwork. Everyone should think about yourself. Am I a part of a team? And is it that teamwork in me? So if it's not there, you need to try to build it. How we can make it? By making relationship. So each trained nurses is in relational thinking, collaborate better in interdisciplinary team. See, one brain can't do much, but two brains, the thinking will be more. If there is three brains, it will be more. It's like fish bonds. Fish bond. So we are like fish bonds. We have many brains attached with, or many thought processes are attached with us. So we can take away the ideas, take away the opinions of different people and put it in a better way for a common goal, so that our teamwork will be increased. And then for that, we need a better communication. Then higher retention and lower burnout. Retention of teachers, retention of staff nurses. It's only possible if there is a good relation with the management, good relation with the personals, or good relation with the hospital authority. Or if it's in the hospital, if it is in the college level or in the institutional level, it may be among teachers, the relation should be good, among superiors or seniors, and among the management. So there will be higher retention and lower burnout. People will not be much trust. If there is more trust, even students also, first year you can see when they come in, we impose a lot of rules and regulations. We impose a lot of into them, and they try to drop out. Attrition rate is more in the whenever there is a more stress. So we should make sure that if you need a lower burnout, that means there should be a relationship based management or relationship based learning. Now, I was discussing about now tell me, is it possible to put it in the practical? Okay, so we will see what are the practical strategies for implementation of relationship based education. First one in the classroom. First thing is possible. It is possible. Second one is use reflective practice. This is more usually you can use it. Collaborate 5 to 6 small peer groups. So collaborative learning, it can be with the teacher, it can be with the peer group also, it is possible. Then teach relational skill. What are the relational skill directly you have to teach them? Empathy kya hota hai? What is active listening? Conflict resolution. It is very, very easy to make conflict. To solve that conflict is not that easy. So it's better not to create conflict. And then emotional intelligence, how to control your emotions. Then foster open dialogue. Open dialogue means open communication. Always better to have a open, create space or limitation. They intrude into anybody's personal space, that become problem. It becomes conflict. So better the space. Relational perceptorship, mentorship. Here we are not practicing, but we need to practice this relational perceptorship. It can be with the junior and senior. Taught what are the difficulty in learning that can be taught. So that is relational perceptorship. Then patient-centered care training. Patients for the patient, real patient. So we need to make sure that patients are with emotions, mannequins are not with emotions. So we need to make sure that students are trained in the hospital. Even then you don't have a chance to be in the hospital side, at least simulator training, it's possible in the skill labs. And then debriefing. It's very important. Debriefing. Has to do this debriefing. Ask the students what you have learned. Experience. Maybe 1 or 2 minutes. It's not possible. Theory also is many hours. Practical is also many hours. Skill acquisition is also too many. So there will be a lot of resistance. So that is one thing, time constraints. What we can do if there is a time constraint, see this first point I have written is overloaded curriculum. This is not from our side, it's from the council side. They have to incorporate relationship-based education in the curriculum. Then faculties and students, what they can do, they can use micro practices. So here, encouraging short and consistent habits like 2-minute reflection, reflective practices, reflective analysis, you can do it. And then you also can do streamline debriefing. Debriefing is also helpful. You can use structured and time efficient debriefing models, which will help the students to learn, even though there is a time constraint is there. Now, second one is institutional resistance. Many institutions or managements may not be willing to adopt this relationship-based model. So that can be one. In that case, we can show the evidences. Research-based relationship-based education, it says about 40% of success rates are there. Even NCLEX, they have used in 2022 authority of NLN, Nurses League of National Nurses League. Of success rate was there. Then they have started from traditional based learning to relationship based learning. The success rate was more. So we can show this evidence, demonstrate all these evidences, and burnout, reduce the dropout. So all this will be promoting or will be a motivating factor for the management. So management can, you can make them to understand so that they will be able to adopt to it. Then start a small pilot study. This is all research based, or engage champions in it, or you can start with align with accreditation standards. You can go along with accreditation standards and you show them the report so that even accreditation agency can also involve relationship based education in the curriculum. Third one is lack of training. The teachers or the trainers or the educators, they are not much experienced with relationship based. They think that students are not respecting, or students, it is a challenging for them. So it will be a challenge for them. So they try not to adopt that. So it's what we have to do is we need to go for faculty development programs on relationship based education, teach them the importance of it, and then teach them how it is going to benefit the students, benefit the teachers, and benefit the healthcare environment or setting, so that they can adopt to it. Every time change is a resistance. There will be resistance in changes. So we need to Understand that. Then model and mentor. Then finally, student orientation. You have to discuss with the student, orientation program to the student, and then you can success in that. I hope you understood. Any questions? Board? No questions? Okay. So at the heart of nursing, education lies the relationship, not just with knowledge, but with the patient, with the student, the colleagues, and to oneself. Without relationship, there is no healing, no learning, and no care. Thank you.
Thank you, ma'am, for your such a wonderful session and delivering an engaging, ongoing and informative presentation today. Your insight on the topic of relationship-based education were invaluable, and I appreciate the time you took to share your expertise with us. Now it's a time of facilitate to our great speaker, Dr. Mariamma John, ma'am. And now I would like to call Vice Principal ma'am to facilitate her. Please, ma'am, come on the stage.
Okay, so your faces are telling the story of your growling stomach. I think you are hungry enough. Esteemed guest, we have now reached our lunch break. Lunch time from lunchtime for 45 minutes. Our students have arranged some fun food stalls and you can enjoy the food for 45 minutes. We will reconvene promptly after 45 minutes for next session. Thank you and bon appetit. Please be on time at 2:30.